Distinguished colleagues, we're about to start. Let us give a round of applause to each other.
And we continue with the third day of the Assembly Healthy Moscow, and now we have a session which refers to a very important aspect of our today's lives. Cancer remains a serious problem in medicine, and public surrounds it with many myths. That's why within the Assembly Healthy Moscow topic, this topic is separated in a special block. Yesterday there was a number of roundtables and seminars on this topic, and today in the Botkin auditorium we continue in Botkin Hall to examine this topic in a specific aspect. We are ready to start this session named Nurse Fighting Cancer. But before moderators enter this scene, allow me to, because it's a special day, a pleasant day, let's speak about good things, positive things, many things which many of you probably expect. I want you to award those people, those employees who in fact became the best in some of nominations. That's why now we will hold a ceremony, award ceremony, which will be not the only one today. We have already awarded today the best people in healthcare, young doctors, and right now within the framework of Assembly Healthy Moscow Formula of Life Festival, we are pleased to award the experts of the year. So let's give a round of applause to those people who are about to get to this scene. And I invite the main expert on nurse activity, Deputy Chief Doctor of the clinic named after Buyanov, Tatiana Ampleyeva. You are invited, and please stand here. And right now, dear friends, we begin our ceremony. Allow me to announce the first winner in the nomination, medical nurse. She's the nurse of the clinic named after Brachrushin brothers, Tatiana Sergeyevna Panfilova. A round of applause to our winner. Winner, a medical nurse, Tatiana Sergeyevna Panfilova. She became the best. A round of applause to her. And together with Tatiana Ampleyeva, take a picture, right, standing, watching our cameramen and photographers. Give it a smile, you're a winner. And we are moving on. We have the next nominee, which is called X-ray expert, X-ray best person. So who is the winner? Working in the public clinic number 22 of Moscow, Roginina Evgenia Viktorovna. A round of applause to her. Ladies and gentlemen, dear colleagues, please welcome Evgenia Viktorovna on this stage. Please take this diploma, the certificate, the statue, and a memorable photo with your colleague. A round of applause to congratulate our winners. The next nominee sounds clear. Obstetrician. Obstetrician is a person who represents State Clinic number 52, Larisa Alexandrovna Kharaskina. A round of applause to her. I do love that. She had this sensation. Larisa Alexandrovna stood up even before I announced her, so a round of applause to her. Thank you for your work, thank you for what you're doing, and obviously our congratulations with your victory. Please take your seat. And the next nomination, the ambulance paramedic, named after Pushkov. Mr. Novostruyev, the first man in this list who is a paramedic of substantia number 46, Alexey Evgenievich Novostruyev. Dear friends, dear colleagues, our congratulations to Alexey Evgenievich. Thank you for what you're doing. Thank you for your job, for your work. Next nomination is for faithfulness to the profession. Well, who is the winner? Senior nurse. of Allergic, Department of State, clinic named after Plitnev, Valentina Zakharovna Prajnikova. Please, a round of applause to her. To a person who is faithful to this profession, not for the first year, for many years in a row, her faithfulness to the profession. These applause are to you, exclusively to you, Valentina Zakharovna. This is to you. And show us your diploma, show your certificate. Thank you so much indeed. And another final nomination. It sounds like the charity nurse. Who is the winner in this nomination? Senior nurse of pathology and preborn children of the clinic named after Mukhin, Svetlana Viktorovna Shibeka. A round of applause to Svetlana Viktorovna. This award belongs to you and only to you. We're glad to see you. This embraces, this applause are all for our winner. Do not forget the picture. And dear ladies and gentlemen, we found out the names of our winners, so let us applaud them once more. They are the best in the professions, they are the best in their nominations, and of course this is worth being respected. And now, Tatiana Viktorovna, I invite you to become the first moderator of our session, Nurse in Fighting Cancer Diseases, Oncologic Diseases. So, dear friends, let us give a round of applause once more to those people who exit the scene as moderators of this session. Tatiana Amplievna joined us already, and please welcome the next person, regional expert on nurse activity of Eastern Administrative Department of Healthcare of Moscow, Deputy Head Doctor with Provincial Personnel, Suburban Personnel, Yelena Grishina on this stage as moderator. Please take your seat. And I would like to invite, as moderator, together with you, with a round of applause, Director of Medical College number 5, Natalia Grebneva. You have the floor. You are moderator. Dear colleagues, dear guests of the session, we start our session to your applause, ladies and gentlemen. You're welcome. And we continue our work. Third session of nurse activity in the oncology, and we invite the first speaker of this session, Nurse Pashkina Alexandra from Oncological Center number 62, about ports. A report which is called Everybody Has to Know About the Port System. Good day, dear colleagues, participants of the assembly. I would like to introduce my report, to make a report everybody should know about port system. Being an inpatient is accompanied as usual by injecting the remedies and drugs. Traditionally, there was a concept of using peripheral veins up to the moment when they are damaged completely and become unavailable. But for quite long, there are other types of vein access which allow to avoid complications for peripheral veins as catheters and port system. Only in our hospital alone, we annually plant over 800 port systems and 100 catheters. Everybody should know about them and know how to work with them correctly. Port system is a device which is planted for the whole course of curing, can be used for over 10 years. This is a safe vein access. Port system is an absolutely implanted infusion system which is composed of central vein catheter, which is connected with a small plastic or metal reservoir with a membrane which are hidden under the skin. The system allows to use vein access for a long period of time. The operation is performed under X-ray devisualization, which allows for correct positioning of catheter in the upper void of the vein. It takes 10 to 15 minutes, and after being implanted, the port system can be used right away. How does a patient looks like with important system? You can see both to the right or to the left. There is on clavicular or subclavian vein or subclavian position. It is located there. Can be small infiltration. If the vein is small, the infiltration can be absent. In this case, port system can be easily palpated. And in the middle, you can see the port system in the X-ray. It's really important to know the preconditions for planting these devices, for installation of these devices. They are the indications for that. They are all indicated for long-term injection, parenteral feeding, drugs for blood, and so on and so forth. Apart from advantages in this slide, a great advantage is that the port system is absolutely hidden under the skin. Nothing is sticking outside and does not prevent a patient to live a regular, usual life. Also, drop bottling can take a long time, and an advantage is that a patient can obtain treatment with both hands free, and he can do whatever he wants, which can actually improve significantly his treatment as an inmate. The advantage for the medical personnel are also hard to overestimate. That's constant access to the vein. No need to make a new injection every time. Reduction of risk of complications, and we should not be worried that the patient will interrupt his treatment and he will not get the necessary remedy. Here are the characteristics on the use of vein access for medication and for the drugs. And port system is taking the leading position, is performing the longest, can be used as long as possible. Working with this port system, it is important to follow the rules of septics. I have to say that if it is infected, port system will have to be removed with long medication, long treatment after that. Here you can see the list of what you need to work with the port system. Nothing special apart from Goober needle. A port system use special Goober needles. The main difference of Goober needles is that it is sharpened in a particular way and the shape of the tip. This configuration allows for easily and relatively painlessly penetrate through skin and membrane of the port system without biting it off. During the puncture, the needle does not cut through the skin, but like spreads it upside. That's why after removing this needle, no hole is there, and after using that, the skin recovers faster. How should you select the needle? Here you have to follow 3 rules. First thing, dense solution should not be injected through a narrow needle. Then you can use without extractor or with extractor, and the profoundness of the depth of location. If we see that the fat layer is quite thick, you should take a longer needle. When it is selected, you can use the function of a port. You consider the place of injection on some possible redness on skin or infiltration or something like that. We process it with disinfection solution. We process the skin, the place of injection. It should be done up to clean surfaces, not less than 2 times. When the skin is being dried out, is being dried, we wash the needle with physiological solution with heparin, as you can see on the formula. Here I have to say that we do not use the syringe of less than 10 milliliters because smaller volumes can provoke excessive pressure. We palpate the port under skin and locate it. Then we hold it with 2 fingers firmly, and under 9 degrees we insert the needle up till we feel the bottom of titanium camera. Do not press too hard not to damage the tip of the needle. If you failed, it happens so that you do not hit the system from the first time. You have to repeat the attempt, changing the needle and select a new place for needle in. The next phase, work with port system. The port system is the same as any vein catheter. We take the blood flow. We check the blood flow and the possibility of infusion by introducing the solution into the port. If aspiration and injection becomes painlessly and fine, this port system can be used and it is ready for work. Then we fix it with sterile bandage and start bottle dropping. The needle can be remain there for a few days. You can find the information that a needle can be left in port system for up to 7 days of work. Our many years of this possibility, the needle has to be changed 3 days within 3 days. With zero alternative. Here are the problems which can be if you avoid these rules and do not follow these rules. The next slide you can see how the sticker has to be located. The needle is an entrance for infection. That's why correct location of sticker is the key to success. We close the inner vein system. We disconnect it from the line and fix it with 2 fingers. We remove the needle and apply a septic plaster over that. Cord plaster. This is a serviceable system. And as every other device, it has to be washed. The main rules how it should be washed. It is washed before and after use with a solution with heparin, and between introduction with a physical solution. If the patient does not use port system, it has to be washed once a month with a physiological solution. And there is a method for conservation, which is done in specialized and not getting back to washing it more often than once in 3 months. Here are the signals where the patient has to go to doctor if you see one of the rules enlisted here. Following the rule and correct cooperation of the nurse and the doctor is a key to success and safe medication. And as for PICC catheter, it is implanted in a peripheral vein of the arm. It can be used for 1 week and more. Here is a patient who has this catheter for 8 months. She's 8 years old. How can we do that? Following the rules of use of catheter, which has to be washed once in 14 days. You remove the old bandage. You consider it a possible swelling. redness, and so on and so forth. It is processed with antiseptic solution, and the new bandage is sticked. You should not stick it to the part of catheter, because during the next rebandaging you can stick it out. And washing the PICC catheter is also performed with heparin, normal saline, once in 14 years, before and after use, and before injection of a new drug.
When we use a number of catheters, we need to use it one after another in order to remember which catheter was used, in order to recall the nearest which should be the next one. And washing, in spite of that, should be performed of each connector. And to finish my presentation, I would like to with a comment of a woman in social media about the port system installed to her body, which explains the importance. First of all, it's the subclavial system, mini operation under local narcosis. Small round thing was installed under my skin, and now the chemotherapy is done by this. Finally, I will have no pain in my veins, and I will 2 hands available. Thank you for your attention. Thank you very much. Will there be questions? I think that there should be questions from heads of department of oncologic assistants, Elena Grishina. Yes, Alexandra, I have a question which I believe will be interesting for many people who do not work with chemotherapy. Is it possible to use blood from the port system? Do we respect the technology? Do we follow the technology? Can we do the computer tomography or magnetic resonance tomography? Thank you very much for your question. I did not recall mentioned in my presentation. It's possible to take the blood from the port system if you follow the technique. A needle is introduced, not less than 5 millimeters of blood, which is drained, and the second portion of blood is very careful and slowly taken in order not to damage the cells of blood. In this case, the analysis will be accurate, and the port system are compatible with the computer tomography and magnetic resonance tomography. One more question. Could you please, do you have any statistics of infection with port system? Yes, in our department we have statistics. Unfortunately, I do not remember the figures, but here we have a head of our department. Maybe this person would help out. The percentile of infections is minimal, and port system are removed due to infection. It happens very rarely. I would like to give the floor. Well, another question from the audience. Please wait. Alexandra? I'm happy. Good afternoon. I'm a professor at Medical University of Dmitrievsky Institute of Sisters of Charity, Department of Healthcare of the City of Moscow. The question is as follows. The protocol of taking care of peripheric vein port system or catheters, you said that it should be washed with the solution with a heparin or normal saline before and after application of a catheter. Does it often need to contain heparin? How often we can use it, and what is the volume? We always use a solution with a heparin if the patient is not allergic to heparin. How often? Well, if a patient uses it every day, it means that it should be before and after introduction, not with the normal saline. Before, we use a solution with a heparin, and in between, usually we do it with normal saline. You mean, what do you mean after and before? Yeah, before the start of work, before the start of period, we close port system. Yeah, that's very important because I did not understand it. And between, you use just normal saline. And the volume, what about the volume of this saline? It seems that 1 milliliter heparin 5000 units, not the concentration but the volume, 0.5 milliliters per of No, I don't mean the concentration, the portion of heparin. What is the volume of solution should be introduced? Not less than 10 milliliters. Or 5 milliliters because the catheter is not long. And PIC catheter, it should be not less than 10 milliliters. Thank you very much, thank you. I would like to give the floor. Please respect timing because we do not have much time. Katerina Silkina, senior nurse of the Plitnev Hospital, clinical research of practical work of the nurse. Good afternoon, dear colleagues. I would like to present you a report on clinical research in practical activities of the nurse. Today this subject is very topical because the oncological diseases number grows, and in 2018 the growth was 1.2%. What about the general growth of morbidity per 100,000 population? The growth was 23%. According to the chief oncologist, in 2018, we made a diagnosis of 30% of oncological diseases on the first stage, which increased the numbers of the previous year by 1.2%. And on the third stage, the number goes down, which is a very good indicator of diagnostics of cancer. In Russia, we made diagnostic more than 3.5 million cancers, and here their percentage and the leading cancers are the breast cancer and lung cancer for men. And I'm a representative of urology department, and I would like to expand on the topic and on the methods of cure which are available. Onco-urology diseases are presented with different types of cancers and cancer of kidney. We will extend on each of them. Prostate cancer. Specific feature were that in 2013 for the first time we detected a lot of new cases of prostate cancer, and growth of morbidity corresponds to the first place. In spite of the fact that currently we increased diagnosis and detection of cancer, the death rate grows. Death rate increased by more than 58% during the last decade. If we maintain this rate, the target indicator of death rate will increase by 20-25%. It's a very bad statistics. In order to increase it, we need to fight against it, and we have to increase our methods and techniques. When we use hormone therapy, we are behind the advanced best practice on all these spheres. Hormone therapy of second stage is not available to many patients, especially in the regions. As for the kidney cancer, it ranks 9 among the malignant tumors. From the point of view of growth, it ranks 3 on the basis of the state statistics. 19,000 new patients are detected every year with a kidney cancer. When they first go to doctor, 30% of them have metastatic cancer, which is another bad indicator. As practice and statistics say, if the cancer is localized, kidney cancer, with metastasis, especially remote metastasis, not less than 10% live for 5 years and longer. Specific features of kidney cancer is that 25-30% of the population detect cancer on the stage of metastasis, even after the surgery, treatment, if there were no metastasis, and very low percentage of survival, less than 20%, as I have mentioned. As for the remedy therapy, drug therapy about kidney cancer, there are many drugs, there are many remedies, medicines, and there are many clinical research for registration of clinical remedies. Today, bladder cancer is behind all the, in terms of all the indicators. The characteristics is it's more spread among men than women, and their mortality rate is larger among men than women, and the average age for bladder cancer is 73 years. As statistics tell us, at the moment of diagnosis is made, the majority of patients have metastasis of bladder. Frequency of 5 years survival rate with the bladder cancer is very low, 6%. And as a rule, they are progressing very fast, unfortunately. As for the cure of the bladder cancer, it's also behind all the oncological pathology activities. Since 1990s, the remedy therapy for prostate and kidney growth, there were no any research for curing of the bladder cancer. As for the immunotherapy, in 1976, for the first time, it was introduced the bacterium therapy inside the bladder, immunotherapy. Today we have enough drugs, but unfortunately some of them are not registered in Russia. If we consider, let us consider what is anti-tumor curement is surgery, is radiotherapy, and drug therapy. As I have said, there are many clinical research. What is clinical research? Any scientific research with the participation of patients, people who are aimed at the real detecting of disadvantages and side effects of any drug. Only after this clinical research, any remedy, any drug can be registered. Clinical research reveals deficiency and safety of drugs, and during the clinical research, the dosage is determined, and we compare the registered drugs with the new ones. Clinical research is an integral part of the process of development of new drugs. Neither company could register a drug without clinical research. Statistics said that every year about 800 of clinical research take part all over the globe. Some of them are taken in Russia. Global clinical research are held, and the question is, why shall we take part in this research? Of course, clinical research is riskier because the drug is unknown. There can be any side effects, but very often patients decide to participate in this. The research because the best specialists work with them, best clinics in Moscow, for instance, and they can have any medication in spite of that, despite the fact that the drug is not yet registered yet. There is a GCP term, good clinical practice, accumulating all the clinical research. Of course, all the clinical research passed through a number of phases: preclinical phases, clinical stages, when laboratory proves the efficiency of a drug, and phase number 3, with some side undesirable effects revealed. Of course, there should be some undesirable consequences. These are weak, like stomatitis and serious adverse events, which can even lead to the mortal outcome. How to provide safety of the participants of research is regulated by a number of legislative acts and laws, and of course the clinical research involves only experienced doctors, researchers. There are a lot of myths and realities. Myth number 1 is that the companies do not have accurate information, they have a placebo, and that they are clinical rabbits or mice. No, it's not so, because the Minister of Healthcare provides permission for clinical research in the Romanian laws and decrees which regulate all the clinical research. Today, any company which is involved in research of a drug consists of many people: chief researcher responsible, co-researcher, pharmacologist if it's required by the design of research, and also a nurse. The requirements to all the members of a research team are very strict, especially to the nurse. She or he should have a special education, acting valid certificate, training, continuous training in GCP or pharmaceutical companies. All the researchers are being controlled by the committees, by the Ministry of Healthcare, by the pharmacological companies. There can be no any violations, or because all the companies care about their reputation. What about the nurse functions? It's divided by 2 parts: scientific part and clinical part, which is exactly working with the patient directly. Studying of laboratory manual is an obligatory requirement for all the members of the team, research team, because it stipulates the whole design of any research and functions of every member of the team. After the manual is studied, the nurse can start her work with the patient is her key activity. She stays with patient, and there is a patient compliance increasing. If the patient has very good relations with medical personnel, the treatment is more efficient and it's easier, it's facilitated. Also, nurse works with biological samples. There are very strict criteria for all the sampling of biological materials. The nurse is familiar with that. She complies with all the requirements, makes all the sample package, transportation company, tracking, the monitoring of results, their return. Nurse is responsible for that, and of course, clinical manipulation are performed by the nurse. She or he is taking this very serious. Its function is very important. She is monitoring the patient. If there are any disorders, she informs the doctor, researcher. Today, a huge breakthrough is achieved in urology, pathology, in field of oncology. There are many immune drugs, and also we are studying their combination. That's why joint work of every member of the team will allow us to fight against cancers. Thank you for your attention. Thank you, dear colleagues. Your questions to our speaker. There are other questions? I have a question as a patient. How to learn about this clinical research, how a patient can take part in that. If you are dealing with it, you know. Could you please tell us? Unfortunately, I didn't have enough time to present it. All the information about clinical research is on the website of the Ministry of Healthcare, because only the Ministry of Healthcare provides permission to conduct this research. Any patient can get acquainted with the design of research, who is the chief researcher, which clinic is involved, and every patient has access to this information. And to address directly to the website of the clinic or to the clinical hospital directly, and to participate in this research. Thank you very much. Our department has 8 clinical research with a very good results. I would like to give the floor to the nurse from Moscow Clinical Scientific Center named after Loginov, Maria Kashutina, implementation of professional competence of nurses in diagnosis of breast cancer. Thank you very much.
Dear colleagues, dear participants of the assembly, you are about to listen to the report, implementation of professional competence of nurse personnel in diagnosis of breast cancer, and I will speak about the diagnosis and prevention of breast cancer and particularities of participation of nurses in these processes on the example of women's health clinics named after Loginov. In the very beginning, I would like to define a little bit about the terminology. Now we understand the tumor, which is coming from the epithelius of the tissue of a breast. This relevance can be considered from the following position. It is a leading position in oncology worldwide among women. Timely early diagnosis requires sanitary information about the population, and high qualified medical personnel is the key to success in and about epidemiology. It is the most frequent cancer among women, which takes first place in the death rate, 17%. According to the International Agency Research in Cancer, which you can see on the slide, 2018, over 71,000 new cases of breast cancer were registered. Average age amounts to around 61.2 years old. And as for the standardized index of growth of this disease, grows by 8.2%. But we at the same time started to figure it out very more often on the first and second stage of this cancer, and a decrease of lethality, of mortality in the first 2 years. I would like to say that breast cancer is not only women's problem, men also face it, but its burden is not as significant as for women. Diagnosis on and treatment are not different from men to women. Our mammological center, the Clinics of Women's Health, is one of the first and leading organizations which are involved in treatment and diagnosis of breast cancer, of mammology. We have 4 branches. We are the expert level organization, and we are dealing in specified diagnosis of complicated cases among patients who have already passed the initial diagnosis on ambulatory and clinical level. In our center, they can obtain prevention, diagnosis, and cure of various mammalogy diseases. Fibroadenomas, some processes of negative process and development, inflammations, and unfortunately sometimes we face oncology. Our experts have cutting-edge X-ray ultrasound equipment which allows for full-scale diagnosis of the patients regardless of personal characteristics, and such an approach allows our patients to pass through additional extra inspection and start treatment in the very beginning of the disease. Now a few examples. 300 people can turn every day. In 2019 we had over 27,000 consultations and found over 2,000 cases of breast cancer. As for our nurses, nurses are a very important and divisible part of every diagnostical process which is implemented in our center. And in these pictures and in the future slides you can see our nurses in their work. The feature of professional activity of nurses can be grouped in 3 dimensions. This is direct participation in diagnosis, prevention of breast diseases, and multidisciplinary approach. Later on during my report I will specify each of the dimensions of our work. First, what we would like to do is participation in cure and diagnosis. As I've said previously, we provide full-scale treatment. Our experts have the following researches: mammography, ultrasound diagnosis, biopsy, tomosynthesis, and genetic mutations. Mammography. Mammography is the main objective X-ray method which is used in mass screening, preventive screenings for women, and it is the main in diagnosis of breast diagnosis of women of 40 years old and older. Ultrasound research is based on reflection of high-frequency sound, which allows us to evaluate the structure of tissues. Due to Doppler effect, we can judge about the blood flow in suspicious parts of breast, which is important for verification of diagnosis and forecasting. The main advantages of ultrasound are its absolute safety, possibility to have differential diagnosis in various types of breast cancers, and looking for lymphatic nodes, which is really important to make statistics if we consider the malignant consequences. Biopsy. Biopsy of breast is taking small samples of tissue for research. Biopsy is the only method which gives us sufficient probability to exclude or to prove malignant. And we are doing trypan corbidiopsia. Thin needle biopsy is the less traumatic. Doctor, assisted by nurse, with the control of ultrasound, makes a puncture and takes a small sample, which is then histologically researches. Trypana biopsy is done more or less the same, but special gun needle which is used, pistol needle which has a cutting edge. In order to have, during this research, we have a column of pathological tissue which allows us for more profound research. Tomosynthesis of breast is a result of digital evolution of mammography, which is used in diagnosis of breast cancer as an additional method which allows to find localization of pathological process. We get this image by summing up X-ray pictures taken from different angles, which gives us a possibility to see the structure of the breast in 3D. Tomosynthesis has advantage that we have to make the pressure twice as less than during mammography. This is ductography. This is really important to diagnose breast cancer and papillomavirus in the hip, if there are any natural liquids coming from the breast. As for the etiological factor, there is no single opinion, but 3 to 10% of breast cancer have genetic mutations in BRCA1, BRCA2 genes. The analysis does not require any specific preparation from the patient and is a puncture of a small analysis of a small blood sample. That means that the patient unfortunately could have inherited this gene and is more preferable to get some kind of cancer, inter alia cancer particularly the breast cancer, inter alia the breast cancer. The next aspect is prevention of breast cancer. Parallel to heart pathology, respiratory diseases, lung diseases, and diabetes are the group of chronic non-infectious diseases which are now the main reason for death of people. Over 75%, around 75% people died of that. That's why control on these non-infectious diseases and these factors of their development is performed by contacting between the people and medicine. Early menarche, later menopause, absence of children, abortion, smoking, alcohol, obesity, small physical activity. To timely find out the classical non-infectious diseases in general and breast cancer in particular, we perform under the regulations of the WHO, Department of Healthcare, and a number of other organizations. We've elaborated a system of initial filling the form of by the population. First, that's what the patient feels, and before getting to the experts, to the doctor, the patient could be ready to make the patient ready for questions from the medical personnel. This pre-tuning of population is important in the conditions of time shortage, and the level of quality should not fall, should not drop. Besides that, our form contains questions which allows to find out the factors of risk of other chronic diseases, not breast cancer. That's why every patient, if during this filling this form, some factors of risk were found out, he has an opportunity to have a short consultation on his risk factors. Responsibility on filling it in is on the nurses of our center. One more factor of attention is informing and training of population how to find it out. In order to find, you should regularly make self-examination. It is important to do it to understand what should be done if some of the signs could be found. Another feature of working of our nurse personnel, which I would like to focus your attention on, is multidiscipline approach. This is universality of our nurses. Most of them have complex professional training and are certified in various segments. One nurse can be certified as a nurse and ultrasound diagnosis laboratory activity, which allows to join the diagnosis process on every phase, helping the patient to work on verification. This approach allows us to provide for a psychological and emotional approach, calmness of the patient, when one nurse can go through all the necessary phases of cure and search. Part of them have training on supreme nurse education. Summing it all up, I have to say that breast cancer is quite relevant problem standing in front of the Russian healthcare and training medical personnel and nurses is prevention and early diagnosis, where the success is laying in multidisciplinary approach to their work. Thank you for your attention. Thank you very much. Marvelous speech. Maria, I'd like to ask you, as for your experience in Moscow Clinical Scientific Center named after Loginov, how many patients were male patients with positive breast cancer? Thank you for your question. You know, I'm working quite recently here. I have been working quite recently for 4 months, and I saw about 10 male patients. You see, that's not our female problems, it's our common problem. But you are in a smaller risk group. Unfortunately, I have to state here that sometimes really young people come in close to the year of birth of 2000, and in 50% of cases we have to suspect for that, and unfortunately we get positive results and have to fight it. So you have to remember about the awareness of male population for the breast cancer. I want to thank you for such a short period of work. You managed to dip into this profession and you feel this situation quite good. Thank you. So good. Good for you. Good for you. The next reporter is represented by Moscow Scientific Practical Center named after Loginov. Senior nurse of colopathology, Turkina Natalia, and assistance of the patients to oncologic of. Good day, dear colleagues, participants of the assembly. I would like to focus your attention on the report's contemporary aspects of nurse assistance with colorectal cancer is one of the key takes one of the key positions. Every year, over 600,000 new cases of cancer are registered. Over 300,000 people die out of this cancer. Colorectal cancer is second and third reason of death among the other cancers. Colorectal cancer is a malignant disease which can be located everywhere. Usually people over 40 years get sick, and in the later groups it is going up. The number is going up. In the right part of this column, it depends on the phase and the percentage of longevity is dropping. 80% in the first half of life, 80%. Second part is 75, 50%, and then 30% with the third phase, and only 5% survive in the fourth phase. 90% and the colon happens to marginalization of polyps. Other factors exist. These are chronic diseases of colon, which is colitis, Crohn's disease, excessive carbon absorption, insufficient fiber and tissue in the nutrition, some pathological blood or pain during defecation, general symptoms, weakness, loss in weight, tenesmus, diarrhea. Diagnosis of colorectal cancer is finger research, analysis of for blood, X-ray of abdomen, and colonoscopy. The most preferable method is colonoscopy, as it allows to find the polypus and to send it to the research. To prepare to colonoscopy, the patient is provided with Fortrans, Picoprep, or Moviprep to clean the colon. If the analysis is approved, the patient becomes inmate and the cure is planned. The main methods of cure are surgical methods. Surgical interference is the initial removal of tumor itself with the tissues around it, and lymphadenectomy, the malignant ones. First goes of the colon, it goes surgery. As for the rectum, there's radiotherapy. There's exclusion of porridges, fresh fruits, fresh vegetables, broths, processed meat, grinded meat and grinded vegetable soup. With complications, such patients need intensive infusion therapy, which is aimed at prevention of post-septical infections, electrolyte damages, and protein leakage. In some cases, forming of cholestoma can be. Cholestoma is an artificially formed thing brought to the front abdomen wall to eliminate the dejection of fecal masses, but the need to remove cholestoma, because psychological factor very often is the reason of depression of the patient, which prevents for further treatment. Medical personnel fighting that. They are explaining to the patient still how to cure stoma and some nuances, ostomy port. In order to cure with the patient with ostomy port is the change in colostomy bag and psychological support. The scientific center uses the Coloplast company. These are colostomy bags, two components and one component. Two component drained colon bags are used for that, colostomy bags. Protection spray, which protects skin from maceration and irritation. Dramatic, which is used to fix the bag on the skin. Modeling rings, which are used to fix it on the skin, but they're more comfortable for self use of a patient and for the doctor, because they straighten the surface of the skin and the bag is standing full on. Cleanser for skin removes the glue, does not dry the skin around it. A neutralizer of smell, which removes unpleasant smell and increases the quality of life of the patient. Before that, the nurse is training the patients, where it shows to the patient how to treat all these chemicals and how to treat the stomach.
During this school, specialists tell about new developments and new items, new inventions. Lovestoma company develops special comfortable underwear for patients with ostomy. It's a belt for fixation of a bag, pants with a special pocket, which are located on the waist. This is not the full list of this company, and this company was founded by a woman who is a patient with an ostomy. She is the person who knows exactly about all the specifics for such patients. There are schools for patients with ostomy, and their relatives also invite there. That is why medical staff pay attention to the prevention of colorectal cancer. They focus on wholesome lifestyle, diet with a large content of fruits, fish, sea products, and also fiber-rich products. Decrease of consumption of red meat, smoked products, salt-containing products, limitation of alcohol, weight control, and of course, people who are older than 45 years old should be examined with colonoscopy or analysis of fecal masses. That would be it. Thank you very much for your attention. Thank you very much, dear colleagues. Your questions. I have a question. Could you please tell me, when you have a colorectal cancer, what types of operation do you perform? Does it matter for the treatment after operation? And what about cure? What about treatment? Do you change something in the care of the patient? In our center, we have a different type of operation: robotic assist operations, laparoscopic operation. It depends on the type of cancer. Major surgery, abdominal operation. If the patient had a lot of abdominal operations before, and probably it's not good for him to have a laparoscopy or the robotics operation, its ratio is 5.2% of the general number of all the operations, and the largest number is laparoscopic operations. Tumor operation with the ostomy, temporary ostomy for the treatment, and then this ostomy is removed, and care for such patients is absolutely different. Mobilization and rehabilitation after robotics and laparoscopy is more faster, and the patients, for the patients, these operations are easy. And if we talk about abdominal operation, because it's not only ostomy but also post-operation states, and it's more difficult for a patient to mobilize. Thank you. I would like to give the floor senior nurse of the Department of Neck and Head Tumor on the State Budgetary Institution, City Critical Hospital named after Bakhrushin, Dalia Sherbakova, role of the nurse on the stational stage of the curement of tumors of head and neck. Dear participants, dear members of the Presidium, dear colleagues, in my presentation today, I will talk about curing of tumors of head and neck. I would like to introduce a work of one of the departments of our Bakhrushin Hospital. This is one of the oldest medical institutions of our capital. In 1887, merchants Bakhrushins, brothers, donated an amount of money to organize the hospital. We are 133 years this year. The first buildings of the hospital were built based on the project of an architect building, and the red brick buildings are a pearl of Sokolniki district. In the 19th century, the territory near the hospital, the prototype of the palliative assistance, it was a house for the incurable patients, and in the future, within the walls of our institution was a maternity house, ambulatory and laboratory for patients, and first tuberculosis maternity house. Contribution to Bakhrushin brothers is huge. It's impossible to overestimate, and which makes us even more responsible today. Our hospital employs specialists with the status of Moscow doctor. Cardiologist from our hospital was announced the best cardiologists, and the nurses, the best nurse of the year in Moscow were my colleagues. Unique department is a department of tumors of head and neck. It specializes on curing of tumors of neck and head, and the head of the department is Nikolai Krivonos, and it's equipped. The department is equipped in accordance with standards. It's possible to understand the role of the nurse without understanding which diseases we're dealing with. The department started its operation in the 70s years of the 20th century. We accumulated a huge experience on surgeries and treatment of patients with malignant and malignant tumors of head and neck. And there is, when we remove the tumor, we also provide plastic surgery and organ prevention therapy. The histology study with morphological characteristics of the tumor is an obligatory condition. Then we estimate the radicality of the surgery made and recommendation for the further. Basal, different type of cancers, melanoma, throat cancer, mouth cancer, tongue cancer, jaw cancer, melanoma. These are the terrible diseases which our patients faced. Operative interference has different characters, prevention, examination. Annually, more than 3,000 people come to our hospital. More than 2,000 of them proceed with surgeries, operations and surgery within the high-quality medical assistance, and the result is reduction of the rehabilitation period, improvement of quality of life of our patients. Of course, achievement of these effects is impossible without teamwork of both doctor and nursery staff. Lately, the healthcare system all over the world is very actively developing 4P medicine principles: personalization, prediction, prevention, and participation. Our story is very long. We may say that we have developed our own principles of working for our staff, for our employees. Every day, we are guided by it. For us, it's fidelity. We are focused on our patients' fidelity or commitment, as we like to say today. Many corporate teams invent a lot of resources to form this commitment. We are proud. The average period of work of our employees is 15 years. Of course, there are longer periods. We are patient-oriented. Localization of tumor processes on the head and neck is very delicate. Unfortunately, according to statistics, up to 70% of patients come to us on the third or fourth stage. Surgery is a radical measure, but nobody said that aesthetics and functionalities also are not important, because these are the parts of our body. Knowing that, it's easier to understand what physical and psycho-emotional state of our patients. We are talking about additional aesthetic defects, violation of such functions as respiratory, ability to eat, to speak. That is why delicate, attentive attitude is a leading motivation for building relations between employees and patients of our department. I would like to emphasize that relations between the nurses, relatives, doctors and patients are built because many of them pass through multi-stage medical procedures. Some of the doctors are our specialists for many years, and sometimes the nurses allow to understand the cardinal changes which will happen after operations. They help you to look at the mirror for the first time after operation. Live with all the limitations. Professionalism. Nurses start communication with our patients on the very first meeting. It's primarily diagnosis, recommendations on examination, and probably stationary medication. After all these procedures, the patients are proceeding with the treatment to our department, and nurse is the person who explains the stages to the patient. There are different nurses, the stationary, senior nurse, other nurses. One of the principles is that every nurse has enough knowledge and skills for being on duty. We need to understand that current conditions provide new requirements to our processes, change of the profile of the patient, intensity, a lot of information intensity. Everything should be reflected in our everyday activities. Within our department, we form algorithms. Preparation for the operation, post-operational treatment, conflict situations, which unfortunately happen in work of each of us. Accuracy, timely operations are the characteristics of the algorithms. Partnership. Nurse at the stationary relative is a leading communicator between doctors and relatives, anesthesiologists, other laboratory departments involved. In addition to the standard procedures of the surgery, the nurse is responsible for informing the patient and the relatives. We also work with the psychologists, with the surgeons, and I will tell you risk factors which provoke tumors. It's very simple: smoking, alcohol, excessive alcohol, radiation, and papilloma virus. A special value is have words to our patients, say very good words about our nurses. She's so nice, help and salvation. She's smiling, she's like a soldier in the army. All the orders are obeyed, and we are like small children. She inspires us, and in this department, wonderful nurses are working. That is why congratulations with on the occasion of their holiday with flowers. I would like to recall all of us, especially for nurses. We need to learn how to listen and how to hear with our heart. Thank you very much. Thank you very much. Natalia, in your report, you said that we live in the 21st century and it's 2020. Very nice number. But you said the shocking number that 70% of patients with head and neck tumors come to your hospital on the third stage. What do you think? Why it happens? What is our mistake? Where we can improve the situation for early diagnostics? Because head and neck is not a colon, is not a stomach. Everybody thinks that recently an oncologist, Pavlenko, died in St. Petersburg, who was a blogger and was writing about his disease. Only few oncologists talk about their disease. Why this number is so big? It's frightening. Thank you very much for your question. One question covered very interesting directions. Unfortunately, the process of occurrence of oncology is something mysterious. Head and neck is what we see, but we do not pay attention, focus attention to many activities, to many events that happen to us with our relatives. That is why, as an advice, when we go outside of the hospital, we become somebody's sisters, brothers, mothers, sisters. We can help, we can support our relatives. If you know that something is changing, that your skin is changing, then that your voice sounds different and you did not eat any ice cream, please start signaling about that. You, as a person who came home, who could pay attention, if your face, any part of your body, there is a wound which is incurable, please pay attention to that. Your neighbors, your relatives, please pay attention to them. This is a really nursery approach. I would like to give the floor the representative of the hospital number 40, Evgenia Orlova, with presentation How to Protect Women's Health. Good afternoon, dear colleagues and participants of the assembly. The subject of my presentation is women protection. We will talk about breast cancer and its prevention. Breast cancer is a malignant tumor of the tissues of breast. In Russia, it's a leading oncology pathology among women, which occupies leading positions for mortality and morbidity level. It's a reproduction system organ. That is why among the reasons are hormone disorders, and there are other factors of risk which influence their age. The risk is highest at the age of starting from 40 to 60 years old, and it's very often observed after menopause. No birth or late birth of children, abortion, women without children or who gave birth for the first time after the age of 35, they in the risk group, especially if the first pregnancy ended with abortion. The next factor is no breastfeeding, because feeding women are rarely subject to this disease, and the longer the period of lactation, the smaller is the risk of breast cancer. You need to pay special attention to the hereditary diseases, because usually it takes place with women who had close relatives with the same problem. From parents, the mutated gene could be transferred to children, which increases the possibility of breast cancer. And you have to understand that the mutation inherited is capable to not revealing itself for a long period of time. Also radiation and lifestyle, hypodynamia, bad habits and obesity. Let us consider the indications of the breast cancer. All women should know that and address the specialist. The most often of them, skin becomes red, more dense, discomfort, but also you should not forget about the nipple state. Any disease requires special attention to the prevention. The knowledge allowed to elaborate very simple and available prevention measures. Women should control their weight, because obesity and excessive weight is related with the higher risk of breast cancer. and other types of cancer as well. Also, you should be physically active, and 30 minutes a day you should do some physical exercises. Pay attention to your diet, high-calorie food.
And the research shows that every day there should be around 450 grams of fresh vegetables and fruits. You have to exclude alcohol. Try to avoid pregnancy avoidance, anti-pregnancy remedies before 20 years old and after 35 years old. It's good to know if there are relatives with such a disease and if there is a complexity of anamnesis. Mammography is appointed from 30 years in order to avoid the appearance of the disease. It is really important to cure non-malignant diseases, and they are cured easily, and in order to avoiding them can prevent the tumor development and examination by mammologist. An important phase of prevention is examination should be done once a month. If a woman has menopause or menstrual periods are not regular, how should you do it? First, you have to look at the appearance of the breast and the skin. Then you have to raise your hands and consider your breast. Then to consider the changes in the breast and the skin color. The next one is putting your right hand behind your head and palpate your right breast. Here you have to find to pay attention if there are some compressings, and then you have to try it laying down and under the armpit. By this simple self-diagnosis, you can find it on your own. Starting from 35 years, you should have to check the breast, and from the age of 40, mammography should be done once in 2 years, and ultrasound once a year. Many times patients say that they are afraid, they don't have time, and don't feel anything. But breast cancer found in the early cases is curable in 90% of cases. Such fear appears among patients due to myths. The first one is if there is an induration, it is a cancer. No, it can be non-malignant induration, which causes no threat. Then doesn't hurt, it's not cancer. If, as we consider the early symptoms, we saw that many symptoms have no pain result. Then it appears after 40 years old. That's the factor of risk factor, but it can appear in young age. Patients think, why should you do ultrasound when you can do mammography and vice versa? Both methods are widely used for diagnosis of breast, but patients do not see difference. Though it is this. Mammography is an X-ray method of diagnosis, and ultrasound is the safest one. Mammography is comparable to natural radiation level we get every day. Contemporary mammograph equipment gives perfect picture. The principle of activity of action is different. With the ultrasound, you can examine the lymphatic nodes nearby. It is also really informative in the analysis of changes which are impossible to see at the mammography due to anatomic reasons. Mammography at the same time is really good for diagnosis of that's why mammography are two compatible methods. If it was proved, if it was positive, then patients face psychological worries with the statistical result of cure. In order to avoid psychological troubles, a single moment reconstruction is performed, and they are included in the standard of cure. And after the operation, patients get the papers and brochures they can use outside being inmate and live in full life. Also, speaking about prevention, I have to say that we have school for patients in our clinics where we have read lectures where we speak about prevention of all body parts and systems, and we have open doors days where we have an opportunity to get consultation of a mammologist expert and go through the research. According to the last data, in the clinic number 40, only 33 patients out of 120 had found no problems with breast. The rest were found. Of course, these were problems of different aggravation, but 2 malignant tumor were found. Its timing is the key, so please take care of your health. Thank you. It's very emotional information. Very nice. I have a question. You said that there is certain prevention. It's for your nurses. Do they participate in this work in the prevention of breast cancer? Yes, thank you for a question. And yes, as I'm working in stationary in the inmate, we are aimed at prevention of repeating cases. And we give the information about compression underwear, which allows to avoid repeatings. Thank you. And we have completed the third session on cancer. This topic is pay special attention, extreme attention. Now we have a break for 30 minutes. At 3:30 is the beginning of the session on dentist activity, nursery and dentist activity. Thank you, dear friends, to our moderator. A round of applause to them. Let us thank them for this session. As Tatiana Viktorovna said previously, I remind you that at 3:30 we have the next session on the dental care and nursery and dental care. Please come back 10 minutes prior to that in order to take good seats and get ready to start off our session. Thank you once more for being the previous session, and of course, if you want to, please stay with us. And thanks to our moderators, dear friends. Our third day of assembly goes on together with you.